Good evening. I'm Rena Sullivan, and welcome to Global News Report. While much of the world has returned to a sense of normalcy after years of lockdowns, masks, and vaccines, COVID-19 continues to evolve in ways that keep scientists, governments, and the public on alert. Today, we're diving into the latest updates surrounding the virus, including the emergence of new variants, rising cases in certain regions, and what this means for global health efforts moving forward. Despite the World Health Organization declaring the end of the global public health emergency earlier this year, COVID-19 has not vanished. Instead, it's adapting. Health agencies around the world, including the UK Health Security Agency, are closely monitoring the emergence of new variants like BA.2.86, commonly referred to as Pu. This variant in particular has caught the attention of scientists due to its high number of mutations, which raises concerns about how effectively current immunity, whether from vaccines or prior infection, will hold up. While Parola hasn't caused a massive wave of hospitalizations or deaths, experts remain cautious. The concern lies in its ability to potentially evade immunity. Much like earlier strains of COVID-19, some regions, particularly in the UK and parts of Europe, have seen a slight increase in cases. For now, most of these infections appear to be mild, but the real question is whether this variant or others that could follow might lead to more severe health impacts. The BA.2.86 variant is heavily mutated, which means its spike protein, the part of the virus that allows it to enter human cells, has changed significantly. We're still studying whether these changes make it more transmissible or better at evading the immune response. At this point, we don't see alarming levels of hospitalizations, but continuous surveillance is critical. In light of these developments, governments and health officials across the world are preparing to address the potential rise in cases, especially as we move closer to the colder months, when respiratory illnesses typically spike. In the UK, officials are urging the public, particularly vulnerable groups like the elderly and immunocompromised, to get their COVID booster shots. This comes as part of a larger push to bolster immunity before the winter season sets in, which is traditionally a time when viruses like the flu and COVID-19 thrive. The UK's National Health Service (NHS) has announced plans to offer updated booster shots to millions of people, alongside the annual flu vaccination campaign. The aim is to create a stronger defense against a potential twindemic, a surge in both flu and COVID cases that could overwhelm healthcare systems if left unchecked. By prioritizing booster programs for those most at risk, health officials hope to prevent a repeat of the strain seen on hospitals during previous pandemic waves. Beyond vaccinations, health authorities are also advising the public to take other precautionary measures, especially in crowded or poorly ventilated indoor spaces. Although mask mandates and lockdowns seem unlikely to return, testing remains a key tool for identifying and isolating infections early. Officials are recommending that individuals continue to test themselves if they develop symptoms, or if they have come into contact with someone who has tested positive for COVID. Even as life for many has largely returned to pre-pandemic routines, some habits have stuck, particularly for people in high-risk groups. Whether it's wearing masks in crowded areas, keeping up with hand hygiene, or getting regular tests, the pandemic has left an indelible mark on how we approach public health. Public sentiment remains divided though, with some eager to move on from pandemic life and others still cautious about the potential risks. Another aspect of this ongoing situation is its economic impact. With global economies trying to recover from the disruption caused by the pandemic, industries such as travel, hospitality, and retail remain wary of any future COVID-19 spikes. While new restrictions appear unlikely for now, businesses are preparing for the possibility of scaled-back operations if cases surge during the winter. The economic stakes are high, as further disruptions could slow recovery efforts that have only recently begun to gain momentum. Ultimately, COVID-19 remains a part of our lives, even as we adapt to a new normal. The key question going forward is how governments, health experts, and individuals will respond to these new variants. With Parola and other potential mutations on the horizon, vigilance remains essential to ensuring that we can control the virus without returning to the kind of disruptions we saw during the height of the pandemic. We'll continue to monitor this situation closely and keep you updated on any new developments. Thank you for tuning in to Global News Report. Be sure to stay with us for the latest in breaking news and in-depth analysis. We'll see you next time.